This film was made for pregnant women and their families who wish to know more about the final phase of pregnancy up to and including delivery and their stay in the maternity unit. Although women are often cared for by their gynecologist early in their pregnancy, they need to contact a hospital or clinic to plan the delivery. For a woman who plans to give birth in a maternity unit, there are 5 key steps. Final antenatal hospital consultation, arrival at the emergency service for delivery, the delivery room, the postpartum period, which includes her stay in the maternity unit after delivery, the return home. This film shows what typically happens in the case of a normal vaginal delivery, although some events, which may not be predictable, can alter the process.
Hello.
Hello.
What kind of an appointment are you here for?
An antenatal visit.
Fine. Your family name, please?
De Cour?
Your first name?
Céline.
I'll give you your documents and explain where you need to go.
Great.
Here you go.
Your doctor has asked us to follow you during the last stage of your pregnancy here at the maternity hospital. I've already read the letter and learned a few things. It is important for us to have a talk so that you can tell me how your pregnancy has gone and about your state of health. I'll ask you a few questions and record the information in your file.
The file ensures the continuity of healthcare. The patient will not always have the same caregivers. Midwives, doctors and nurses will succeed one another depending on the day and week, but they will always have access to the same file. The file follows the mother constantly while she is in the maternity unit.
Have things gone well up to now?
Very well, yes, thank you. Nothing special to signal. Fine, everything's been fine. I have had heartburn the last few weeks, but it isn't stopping me from having a normal life.
I understand you're in good health?
Yes, that's right.
And you can feel the baby moving properly?
Yes, it's starting to, yes.
That's good.
For the last 2 weeks. Yes, the baby's been moving regularly for the last 2 weeks.
During this consultation, the doctor checks to see how your pregnancy is developing. He will not do a routine vaginal exam or an ultrasound unless it is medically indicated.
Now I can go next door where the midwife will listen to the baby's heart, measure the height of the uterus, palpate the position of the fetus, and we'll make sure that all's well.
We'll turn the sound on. The heartbeat is very regular. Still 140, 140, 145. It's a good rate. Everything's normal.
Okay. Yes. Keep going straight. Yes, hello, this is Céline de Cour. I'm phoning to tell you that I'm on my way to the maternity hospital. I'm 3 days overdue. I'm having contractions every 10 minutes. I'm on my way. All right, I understand. Thank you. I'll be right there.
The obstetric emergency service is there to welcome and reassure you. A pregnant woman must be aware that she can come to the emergency service at any time for reasons other than childbirth. For a pregnancy checkup, for example, if she is worried about something. Once you are admitted, you will have an initial examination by a midwife to see what the emergency is and to diagnose you in consultation with the doctor.
The baby is reacting well to the contractions. Everything is fine. How do the contractions feel? Can you handle them?
It's,
I'll show you the slide again. How would you rate your pain?
let's say I can handle the pain at this level.
Very good.
7 on a scale of 10?
Yes, very good. Perfect.
In this particular case, the patient is taken to the delivery room. However, another patient may be told to go home. Or she might be hospitalized in the prenatal unit if there is a danger of premature birth, or if she has to be monitored for high blood pressure, or needs specific treatment.
You'll be in your room. You don't need to stay in bed. In fact, I suggest you walk around if you can, or ask my colleagues to use the balloon, which I think they've already shown you. I think that labor is going to start slowly, all by itself. And when the contractions get stronger and begin enlarging the cervix a bit more, we'll move you to the delivery room.
Okay.
Okay?
Yes? All right. right. Very good. Okay, thank you. Joanne, Mrs. Decourt is coming to 5. First baby, contractions.
Hello. We don't know yet if it's a boy or a girl?
No.
It's not easy to keep up the suspense.
No.
I believe you.
The midwife checks the opening of the cervix and the baby's heartbeat. Everything is done not only to ensure the safety of the mother and child, but also to respect the private, personal experience of childbirth.
Try to relax completely. It's important to be able to re-energize and recharge your batteries after each contraction. Was that a contraction? Okay. Stay calm. Take a deep breath and breathe out. Very, very good. Now, once more. Breathe out as far as you can. Push the contraction out of your body. Good. Perfect. Bravo. Once again, until it's gone. We're not in a hurry. Take all the time you need. The monitoring has been excellent up until now, since I turned it on again.
The delivery room is where the child will be born, but it is also where the mother will be spending a few hours before and after delivery. Safety and respect for the well-being of mother and child are the hallmarks of the entire process.
What is it?
A boy.
A boy?
The time after birth is crucial for the mother and child, who will learn to know each other. The midwife's help and advice are priceless when it comes to the baby's daily care and helping them to get ready for going home.
Fine. Thank you. Birth was hard, but what matters is the baby's fine.
Yes. Here's the little bundle of joy. Let me give you some practical information about our unit.
Our team of doctors, midwives, nurses' aides and assistants are all here to take care of you.
Are you thinking of returning home soon after delivery or staying on in the postpartum unit?
I haven't made up my mind yet. But the best
The
thing would be-
gynecologist, pediatrician, midwife and mother decide together how long she should stay on after the delivery. After a normal vaginal delivery, the mother stays on 2 to 3 days. A midwife can then come to her house to help her and advise on the newborn's daily care. However, a longer stay will be necessary if there are complications, if the mother feels very tired, or if the baby requires more observation because of jaundice, for example.
Okay. The baby is slightly yellowish, but
Yes, I see.
indeed, if the jaundice gets worse, we prefer that you stay here so that you don't have to bring the baby back for further
Okay,
treatment.
we'll check the results. We'll wait for the results to be sure.
A pediatrician always sees the newborn within the first 24 hours. He will see the child once again just before it leaves the hospital, unless of course there is a problem in the meantime. A fully equipped nursery is at your disposal for changing diapers. The newborn is usually bathed and cared for in the morning. However, arrangements can be made to do so later on in the day if you wish.
I think I'm in love with my son. When I tell my husband, it's going, oh, it won't. He won't be happy when I tell him I'm in love with his boy.
People usually check out of the hospital in the morning. You will see the gynecologist before you go. He will give you advice and answer any questions you might have.
Bye-bye. Goodbye.
A midwife is available to come to the home to help and advise the new mother on her newborn's daily care.